All right, good morning, everyone. Thank you so much for coming. My name's Rachel here. I'm here to introduce our speakers this morning. The first is Dr. Dawnelle Paldino. She began her career at the VA in Pittsburgh healthcare system in 2006 and is a clinical psychologist in the outpatient mental health clinic. Her clinical areas of expertise include couples therapy and transgender care. She is one of the VA Pittsburgh's LGBT veteran care coordinators and the regional VA LGBT lead. She also currently serves as co-director of the National LGBT Veteran Care Coordinator Program. Additionally, Dr. Paldino is team leader of VA Pittsburgh's Interdisciplinary Transgender Treatment Team and is Behavioral Health Initial Evaluation Clinic Coordinator. Dr. Paldino also trains and supervises predoctoral psychology interns and postdoctoral psychology fellows in both clinical and administrative work. Our other speaker is Dr. Ronald Codario. He completed his internal medicine residency and fellowship and endocrinology at the University of Pittsburgh Medical Center before he began his career as a staff endocrinologist at the VA Pittsburgh Healthcare System University Drive campus. His areas of interest include diabetes, obesity, lipidology, hypogonadism, and transgender medicine. He is also a proud member of VA Pittsburgh's Interdisciplinary Transgender Treatment Team. Dr. Codario also serves as a mentor and supervisor of endocrinology fellows and internal medicine residents and introduced formal transgender medicine teaching into the University of Pittsburgh's endocrinology fellowship curriculum. So please join me in welcoming our speakers today, and please feel free to give your feedback on the podium on your way out today. So thank you.
Good morning, everybody. Thanks for coming to our breakout session. We've had a lot of wonderful talks this morning and yesterday about LGBT health-focused topics we're passionate about. But one thing that we haven't talked about are LGBT veterans. So we are excited to be here to talk about our veterans. They're often forgotten about, and they're really important. And even if you're not working in the Veterans Health Administration, I guarantee you, if you're a healthcare provider, you are treating people who are veterans and identify as LGBT. And they may not be choosing to come to the VA for their care. So we're glad to see you here, and just thank you for coming. We're going to talk to you today specifically about transgender veterans. So we're going to talk about an interdisciplinary team-based approach to transgender veteran care. We are going to cover a few things today. First, we're going to talk about why it's important to have a special focus on transgender veterans. We are going to talk about how the VA specifically is addressing health disparities, the barriers to access to care, and we're also going to talk about how we developed our interdisciplinary team-based approach. We currently have a team of 27 interdisciplinary members across our VA hospital, and we're going to give some tips and guidelines for how to develop your own team if you're interested in doing that, or if you're in the process of doing that or hope to do that in the future. So our big disclaimer is we have access to great resources in the VA, and that's not a well-known fact, but we are appreciative of that every day. So we know that some of the things that we are going to talk about, you might not have those resources available to you, but the general guidelines, the general timeline, and the general tips should be applicable to any organization or facility. So I want to ask you all first, you came here, you chose us over the other wonderful topics. When you think of VA and when you think of LGBT health, what comes to mind? Honest.
Completely separate.
Completely separate, right. You don't merge the two. Like, they don't go hand in hand, right. Anyone else?
Don't ask, don't tell.
Don't ask, don't tell. Exactly. Very good. Anyone else?
If they can't serve in the military, can they get VA care?
Right, we're talking about transgender veterans. We can't see them at the VA, right, if they can't serve in the military. Very, very good. So we're going to clear all that up today, hopefully. That's what you think of. Show of hands. Who would think that if I'm an LGBT veteran and I go to the VA, I'm going to be exposed to a welcoming environment? No hands. Who would expect that VA policy is just going to be an extension of Department of Defense policy? Yeah, lots of people. Okay. Again, we're going to clear all that up. We're really happy to be here to clear all that up this year. Okay, so we're going to talk about these things. By the end of the talk, we hope that you will know what transgender veterans can receive through VA care. We hope that you will think about that context of don't ask, don't tell, and what these veterans experienced in the service and how we really are appreciative of that when we see them for their health care at the VA. And also thinking about some very kind of unique, innovative ways to combine some services for transgender individuals that we do at the VA. Not just transition-related medical services, but also supportive services, psychosocial, and adjunctive kinds of treatments. All right, so why are we focusing on transgender veterans? First, we want to just be clear about what we mean when we're talking about transgender veterans. Since we are in a healthcare facility and we're in the VA, our treatments must be medically indicated for that condition. So when I'm talking about a transgender veteran, we do serve all veterans who identify as LGBT and related identities. But for today, we're talking about veterans who meet criteria for gender dysphoria and are seeking services from our team for their adjustment, for their transition, or just support. We know that there are about 20 million US veterans. Of those 20 million, we estimate that 134,000 identify as transgender. That includes 15,000 on active duty. So there are individuals who are active and veterans. They might be in the reserves, National Guards. We also know that VHA, when we say VHA, we're talking about Veterans Health Administration, so all the healthcare facilities that VA offers. We know that LGBT veterans, particularly transgender vets and women, are more likely to choose VA for their care and or more likely to only have VA as their healthcare benefit. We also know that veterans are typically older, an older population, they have more medical conditions, they're more ethnically diverse. And so, again, we're gonna start thinking about the context of what it's like to be an LGBT veteran. We need to think about them as having more than one minority status. They identify as LGBT, they're also veterans. For the purposes of our talk, we're also specifically thinking about the transgender minority status. There's two key points on this slide that I want you to really pay attention to. So this slide, we're talking about veterans who meet that criteria for gender dysphoria. Gender dysphoria prevalence in VHA is 5 times higher than the prevalence of gender dysphoria in the general US population. This is not due to misdiagnoses, is not due to willy-nilly slapping the diagnosis on these individuals. What we know from talking to our transgender veterans is their choice to go into the service, not those who were drafted long ago, but those who chose to enlist. Their choice to go into the service was often related to their gender dysphoria and their struggle with gender identity. Even if they didn't know that's what was going on with them at the time, even if they just knew they were struggling with something. So some of our transgender veterans tell us that they go into the service because they were having such a hard time functioning in their life that this gave them direction. The military service gives structure, order, organization. It gives you a future for at least the next several years. It gives you career training, housing, financial stability, healthcare. So some of our transgender vets, this was their way to survive. I'm gonna go into the military and get all of these resources for myself because I'm really struggling. Some other transgender veterans tell us that they go into the service very consciously as a way to cope with their gender dysphoria. So more often than not, these are individuals who were assigned male at birth. They are struggling with their gender identity. They see the military as being very hyper-masculine. I'm gonna cope, I'm gonna compensate, I'm gonna deal with this, I'm gonna be who I'm supposed to be, I'm supposed to be male, I'm gonna go do this. And then they struggle, they experience intense psychiatric distress, and we see them afterward. If you pay attention at all to veteran statistics, you will know that veteran suicide rates are astronomically high. We lose about 20 veterans every single day to suicide. If you add on gender dysphoria, you are amping that rate of suicide-related events 20 times higher. We also know, again, if you pay attention to anything about veterans, that they're at higher risk of all of these other things: mental health conditions, substance use disorders, medical conditions, psychosocial problems. Gender dysphoria makes someone that much more at risk, very, very high risk. So again, I'm trying to paint the picture of what it's really like to be a transgender veteran struggling. And as you said, don't ask, don't tell, we can't forget this. we had Don't Ask, Don't Tell from 93 to 2011. If you were found out to be LGBT, you were discharged. No one was ever discharged for asking or inquiring or investigating or trying to figure it out. But if you were found to be, you were out of the service. You lost all of those resources that I just mentioned: finances, housing, healthcare, etc. 2016, we had a wonderful turn of events, and it was open service for transgender service members. April 2019, new DoD policy comes out. You cannot serve as transgender. You can't enlist as transgender. I'm going to speak very clearly. If you were grandfathered in, you could serve in your identified gender and still get services and treatments. You can't enlist unless you agree to enlist and serve as your sex assigned at birth. So I want you to think about this. You experienced all of this. You're coming to the VA. As I saw with no hands, you wouldn't expect that the VA is welcoming because you think VA and DoD are the same thing. They are not at all. VA is welcoming, affirming. We provide tons of treatments. We strive to be a national leader in patient-driven, culturally competent, personalized care, and that extends very much so to our transgender veteran care. So we're going to talk about what VA has done. Remember I said Don't Ask, Don't Tell was repealed in 2011? 2011, VA created the National VA LGBT Health Program. This is a central office, national office, gets funded, national program. We do three things. We develop policies, and I'll talk a little bit more about that in a minute. We inform and engage veterans, I'll talk about that more in a minute. And we educate staff and promote training. Two things I want to note here for the purposes of this talk is that we have two really great training opportunities and education and consultation opportunities. Transgender e-consultation program is one. What that is if you're a healthcare provider anywhere in the country in VA, and you're working with a veteran who's coming in talking about their gender identity struggles, they might meet criteria for gender dysphoria, or they're identifying as transgender, and you want to get some consultation about anything. Medicines, primary care, mental health care, you name it. You can enter this e-consult. It's going to go to one of 3 expert teams in the country, and these expert teams are experts. They are not just affiliated with the VA, they're doing their own research. They've been in the field for many, many years. They know what they're talking about. You get a quick e-consult response. They're also available by phone. So that's one nice thing about the VA network. We're nationally able to contact and connect with anyone that we get a name for who is an expert and can help us. What VA wants to do is not promote transgender veteran care as a specialty. We recognize that you need to be culturally competent and receive very good training, but we want every single person in the VA who's working as a healthcare provider to believe that they can do this, and they will do this, and they will treat the person in front of them. And if they need education and training, then we will give that to them, and we will be there for them. But that there's not any room to say, I can't help that veteran, I'm not competent in that area. No, that's not an excuse, and we're not gonna take it. We have these services, we're gonna help you through it, you need some help. The Transgender Scan Echo program is a virtual training that's much more extensive. And for this, the goal was to reach out to the rural VA facilities, but what we've ended up doing is train any VA facility that has the leadership support and applied to be part of this training program. So it's several months long, it includes lots of didactics, and it includes lots of case consultation, again with expert teams. So I just want to highlight that for our talk. In terms of our policies, there's no Don't Ask, Don't Tell in VA. We have completely welcoming and affirming policies, but we were just talking to someone about our residential programming. We are going to house and room a person based on their gender identity, and we're going to protect their privacy. If we need to consult ethics, if we have other veteran complaints who somehow have found out, then we deal with that, but we don't change that veteran's care or their services. Our non-discrimination statement includes protections for sexual orientation and gender identity. And we have 2 specific directives that have very detailed policies about LGBT veteran care and transgender veteran care. The national program established the VA LGBT Veteran Care Coordinator Program. So if you heard Rachel speak my bio, you would have heard her say that I'm one of Pittsburgh's LGBT Veteran Care Coordinators. And we have a couple others in the room from Butler and Erie here. Every single VA healthcare facility has at least one. We are the point of contact. We are the care navigators for LGBT veterans. We develop new services if our facility needs them. We train staff. We do tons of outreach. We are the person that a veteran can call and say, is the VA going to be open to me? Can I come? How do I get good care? And we will do that for them. We also will work with any department in our facility to create a welcoming environment. We have visible symbols of safety, and I'm happy to say I run out of these all the time. We have, I don't know how many people we have at VA Pittsburgh, I don't know how many employees we have, but I run out of these all the time from all across the facility of staff asking for these. We have posters, we have fact sheets, we partner with suicide prevention, we partner with the Women Veterans Health Program. This is just a small handful of the many welcoming environment tools that we have. So, we've talked about why it's important to talk about veterans. We've talked about what the VA has done. I'm going to hand it over to Ron, who's going to talk more about what we specifically do at VA Pittsburgh for anyone here who's local. And when I say local, we're kind of an expert team also for Erie and Butler and Altoona, Clarksburg, West Virginia. So I say local, but think of us broadly.
All right. Well, remind me to never follow you again for a talk, because that was fantastic. Round of applause for Dawnelle. But I'm Ron, pronouns he, him, his. And yeah, she did the hard work. I just get to tell a fun story about how we created our team. So yeah, our VA Pittsburgh Healthcare System Interdisciplinary Transgender Treatment Teams. What I'll do is kind of like tell our story, but then mix it up with, tips or helpful hints, things like that. I want you to understand, like Dawnelle said, we have certain resources that you may not have, or you may have resources that we don't have. So this is just how we did it, and some thoughts, and at the end, we really would like to hear if anyone has any additional thoughts, or if they've tried to do this, barriers that they face, things like that. So, Dawnelle already alluded to this, but we started out with our training through the Transgender Scan Echo program. And that was, kind of like a nationwide training. We interacted with experts via telecommunication, multiple couple-hour-long sessions, and we had about 20 people do that. Afterward, we felt like we were really motivated to establish our own team, and we felt like we had a reasonable baseline understanding of how we can take care of transgender and gender non-binary veterans. So we would suggest, if you are interested in starting a group like this, unless you're already an expert, which is fantastic, probably start out with some kind of training like that. Of course, if you're at a VA, you could do that. But if not, there are plenty of other places where you can get training like that, or you can piece together training from multiple different places. We mentioned the Fenway Institute here. I think UCSF has some great stuff, and tons of other places. There's plenty of literature. I mean, WPATH guidelines are great. We refer to those all the time. But this is a good first step. At least it certainly was for us. And so, as I said, after that, it's important to continue to meet, to kind of establish a group. It's good to train people, but it's better, once they're trained, to keep them engaged, keep them motivated, keep them working in the field. And so that's what we did. But that involved some logistical things, having a team leader, choosing a team name, making sure that we had institutional support, depending on what kind of organization that you work in, and then reaching out to more people, even if they weren't able to attend the training, because again, you can train in multiple different ways, or maybe there are already people that already have a level of expertise that don't need as much training. And we encourage people to reach out, and this was, and continues to be, I think, my favorite part, because I have to say, I had a lot of the same preconceived notions as you guys, even when I started working at the VA. Even though I thought it was a great place to work, I thought it was, and still continue to think, it's a great healthcare system. I assumed that the LGBT care at the VA would not be so fantastic. But I found out not only was that not the case institutionally, but interpersonally, there were so many people that were so interested in doing this work, and they just didn't know that we were forming a group until we told them. So it was really refreshing to see, and again, it gives you that sort of motivation to just keep going at it. There we go. And again, more logistical stuff is important, and scheduling meetings, making sure we're meeting regularly, and deciding what exactly we are going to do. So, and this may depend on what the needs are in your community or your institution. This may depend on what the availability is, the size of the group, things like that. But we decided to have kind of a broad mission. We do a lot of different things in our group. So of course we talk about clinical care, we review cases, we work together to help individual veterans, but we also do additional training. We collaborate with different departments in the VA or sometimes different organizations in the community. We do outreach. So all of those things and more can be incorporated into a group like this, but you don't necessarily have to do all those things. It could just be a treatment-focused group and that's it, that's what you need. You need to bang it out real quick. You have a short amount of time to work with. And it's important to talk about, again, what your values are as a group. Kind of, what do you want to focus on? Where do you see your, again, institutional or individual challenges or barriers are, but also what your strengths are, and how you want to incorporate that into your group so it can be as excellent as it can be. And in terms of, again, kind of the logistical time stuff, what I like most about our group in that regard is that I think when people hear of a concept of an interdisciplinary team, they think, and of course this is totally fine too if you can do it, but they think everybody gets together, they're all in the same room at the same time, it's every week, there's a physical location, that's when you see the patients and that's it, everybody has to see them at the same time. That can be very limiting for a lot of people. People are very busy, and also it's very limiting, I think, sometimes for the people that you're serving, because, as you can imagine, us as providers have to see more than just transgender individuals, right? We have to see tons of other people. So if we have just like one half day a week where we see transgender individuals, or even one half day a month, gosh, that's going to be a problem for a lot of people. So our organizational structure is a little bit more loose. We incorporate our transgender patients into our regular clinics and into our e-consultation time and things like that. But we meet together as a group to coordinate and facilitate care and discuss care so that it's easier for everybody, but we can still accomplish all of our goals. So I guess what I'm saying is not everybody has to work in the same clinic at the same time in order to be a cohesive team. And then developing standard operating procedures, again, is sort of important to maintain that cohesion, especially if you're not doing it all together all at once, but even if you are. So, how do people get referred? Who is triaging the referrals? Who do they go to first? How are the services that are available communicated to them? Things like that. And well, this has been highlighted, I think, in a few different talks, but we're definitely not motivated by a gatekeeping approach. I was thinking about what our approach is more like. It's more like a welcome wagon. Like, we do have people that they come to first, And it may seem like a gatekeeping approach, but it's really not. It's just like, here we are, come to us. We're the ones that are going to take a detailed history, talk to you about all the resources that are available, and then refer you to whichever resources you want to seek out, or whichever ones you feel are appropriate for you. So yeah, it does come to a select group of people, but again, it's more of a welcome wagon approach than a gatekeeper approach. And then as far as determining the care pathways, kind of already touched on that a little bit, but I think that's an important thing to think about standardizing if you have that approach, if you have that, okay, they're all going to a small group of people, how are you going to document those interactions? Is that just going to be a clinic visit? And that's how you document it as a regular note? Is it going to be something else? How are you going to track it? How are you going to keep track of these people to make sure their care is coordinated and facilitated? And are you going to use templates? Make sure that everyone is using a standardized kind of support letter, things like that. So again, I think this all speaks to the cohesiveness of the group, which makes things, can make things a little bit less challenging in a very complicated, potentially complicated clinical situation, but also lets people know that, or gives people the impression that we're all on the same page, we're all here together to help, we all have the same goals. And then, once you've established your what you want to do, who your people are, what services you offer, how you offer them. You want to start to advertise those things in different ways and kind of broaden your horizons a little bit. So, we created a consult whereby any provider can access all of the services that we have available for transgender individuals. And we have brochures and other mechanisms to advertise that. But we also have support groups, and sometimes the patient will come through the consult process first, then go to the support group, but that's not necessary. And we have a whole lot of different integrated services that I'll go into some detail here. So we have representation from a ton of different specialties. Primary care is huge. And we have several primary care kind of transgender champions. As Dawnelle said, we would like everyone to have a baseline understanding of how to care for a transgender person in a culturally sensitive way, but we have some primary care physicians that have achieved a greater level of expertise. Mental health, of course. Drama therapy, which is something that I really didn't know anything about when I started, and have just discovered what a wonderful resource it is to have a safe place to engage in adjusting to a new role, adjusting to a different gender expression, do some role play. Similarly, spiritual counseling, which again, not something that I associate with the federal government, but we have that available. I mean, Gretchen was part of our group from the very beginning. Hormonal therapies, that's mainly our realm, endocrinology, but there are primary care physicians that are comfortable with that as well. Nursing, so that's critically important because there are, I'm speaking from my experience, giving injections and things like that. It's really important to have nurses who are trained in cultural sensitivity for transgender care. Voice and communication training, of course. Clinical pharmacists, we have clinical pharmacists that work with us. Social workers. Our dermatology department is active in laser hair removal, which again, something that a lot of people don't know that the VA has to offer. We absolutely offer that, it's covered. Prosthetics, We have a really great prosthetics website where we have access to different vendors for chest binders, stand-P devices, all those kind of things with really great tips about how to get them covered, how specifically to ask for them, how they should be sized, what the options are. We're spoiled, but I love it. But the thing that we always are telling ourselves is we want to just continue to expand the services that we offer, because for as much as we know about, there's probably even more that we haven't considered. Just some of the things that came up, like I mentioned earlier, drama therapy, occupational therapy, for, again, something that as a cisgender heterosexual male wouldn't occur to me that, oh yeah, of course, hygiene and grooming are going to be different when you transition, and you might need help with that. Occupational therapy can come in there. Physical therapy with gait modification training, that's something that's unique and very interesting to me that we have as part of our group. So lots of different things. And then the other thing that I would encourage you to think about, and I guess this is another theme that I think has been popping up all throughout the conference, that make that 1% change, or another way to put it is don't underestimate what just one person can do. One person that has, a little bit of knowledge even, and a little bit of enthusiasm can infect their whole surrounding environment and encourage people to come and engage in the process. But also, not just the encouragement, but the knowledge is there too. So if you have a champion in a particular department and they make themselves known, well, guess what? If someone who has less knowledge is caring for a transgender person, they can say, hey, I know that you have some expert level knowledge in this. This particular issue comes up or came up. Can you help me with that? So it's a way to spread not just enthusiasm, but knowledge as well. I mean, there's the formal training that we talked about earlier, but there's that informal kind of conversations, those one-on-one conversations that can be very important. And then, of course, there's outreach. I mean, in a way, to a certain extent, again, we're a little bit spoiled because we almost have a captive audience. But it's still important to do outreach. It's still, I mean, of course, in general, VA not excluded. We go to Pride, we utilize social media, we have a lot on the websites, screensavers, as I said, flyers, brochures, posters, things like that. And this is another kind of self-perpetuating process because people in the community will talk. So the more people you recruit to your practice, assuming that you're doing an okay job, the more people want to come to your practice. So again, this is another one, and this is fun too, especially when you get approved for it and you can even count it toward your time, or some of us just do it for fun, like me. But that's, I mean, again, as I said, is that a comprehensive approach? Is that everything you might need to know about creating an interdisciplinary team? No. But that's how we did it, and those are kind of the tips and tricks that we thought of. So we want to thank you for being here, but I hope that we left time for plenty of questions and plenty of feedback. Thank you.
I was just going to say, there's about 5 minutes per question.
5 minutes, okay, sorry. Question?
I was curious about, I know that you touched on this very briefly, and I just wondered if you could speak to the idea of getting devices such as stand-P devices or chest binders or gaps covered by insurance. Is that specific to TRICARE and other, like, VA coverage mechanisms? Or,
Handle that one.
So as I had made a point to say, we're talking about veterans who meet criteria for gender dysphoria. So as long as we have a veteran who has that gender dysphoria diagnosis in their medical record, they have full access to those prosthetic items. Our National LGBT Health Program, we have a wonderful deputy director who was like super computer savvy, and she created this prosthetics wiki, and that's what Ron referred to as a website. And so she has made it easy for us to request those things. So when we put in a prosthetics consult, we now have language that refers to this as a medically necessary treatment for the condition of gender dysphoria that makes it go through much faster. We have vendors reach out to our national LGBT VA health program that say, hey, can I become an approved vendor for VA? And we are more than happy, and a lot of these are LGBT individuals who've started their own companies.
Yeah.
And so we are more than happy to get them vendorized through the system. And then every different VA facility, even though we're all connected, each facility would have to vendorize them. But we are spoiled. It's kind of an easy process for us. I wish it was easy for LGBT vets all over the country, but in the VA, it's a really great system. And the VA is not, we get bad rep. We are a nonprofit federal healthcare organization. We can't advertise. We can't do those things and put out the publications. So we're happy to come here today and say that it's an easy process. But because of that, we're not the best at giving any tips for insurance outside of the VA. But through our VA healthcare benefits, it's a very easy process.
How would you recommend handling when veterans are uncomfortable with having the diagnosis of gender dysphoria on their chart, on their record?
Yeah, we definitely have had. Do you want to take that one?
No, this is so much more in your bailiwick.
That's something that comes up often, and we had to pick a name for our team, and we can't ever pick the best name, but our team has the word treatment in it. And we have some of our trans vets come through and say, I don't like that you're saying this is treatment, this isn't treatment, this is who I am, and we're like, we totally get it. We had to pick a name, and I'm sorry, that's not the best one, but we receive you like a welcome wagon. So we talk about it in a very open and discourse, with the way insurance is now, for us to get you these services, we do need to do a diagnostic assessment. And I'm sorry for that. And we also have veterans who receive services from our team that don't meet full criteria for gender dysphoria. We're not going to say, no, you can't get access to our spiritual counseling, our drama therapy, our speech and communication services. Those are all things that people can get access to. What they're not going to have an easier time getting are the prosthetics items or the hormone therapy, or we can't refer out for surgery. So the one service that VA does not cover is surgeries right now. We can't refer out as a federal organization, but we can make them aware of surgeons that we know about in the state or as close by as we can. So we talk about it as a limitation that even us as providers have, where we have to assess you for this diagnosis, but it's not going to get in the way of us being there for you and giving you all the services that we can to help you through your transition, or help you find someone in the community if we can't give something to you.
Can I just make a comment about the support groups that you were discussing? I know that the LGBT Veteran Care Coordinator in Pittsburgh, Sarah, at the campus, has a support group that is held at their side. So a lot of times veterans are really uncomfortable seeking care at the VA, like you said. And one of the great things about a support group like that, or when you're looking for a veteran support group outside of the VA system, is you're hitting a huge, veterans who were discharged because of identifying it as this way during this period are able to access those support services outside of the VA. They're feeling much more comfortable to do that. So I just thought that was really awesome.
There's one other.
One more?
Oh, sure. I have a question. So with such a large team, there's bound to be competing priorities for the groups. And how do you mitigate kind of those priorities, and how do you work with the individual to set that pathway?
Yeah, I mean, sure.
Well, my initial reaction was I chuckled because we've not had any.
We haven't had a ton, but I think I understand what you're saying in terms of, people have clients have limited time to potentially access all of these wonderful resources. But we let them guide the process. What resources are most important to them, and that's where they go first, and that's where they go second, and that's where they go third. And I always tell people I offer them everything, but they don't have to take advantage of any of it, or they can take advantage of just one element of it. So we just let the client drive the process. And another fun thing about working at the VA is we don't really have RVUs. We don't really have much competition, especially internally. If someone doesn't want to come see me, oh well. I mean, good for them. I'm not going to get upset about it. And similarly for all the other specialties. We would love for them to access as much as they want and feel comfortable coming to any specialty. But there's not as much room for direct sort of competition and conflict in terms of recruiting people between the different specialties. It's just whatever you want, here it is, here's the menu, take it or leave it. So we let them drive.
Yeah, so we're lucky. We're all a really easy bunch to work with and really invested in the work that we do. And it's all voluntary. I mean, we all have just asked supervisors if we have the support to attend these meetings and be involved. But the one other thing that came to mind when you said that is, depending on a veteran's eligibility status, they may have a copay. And they may have a lower copay or a higher copay. So it may be that the veteran has to decide which services they want to do first or start with because they can't afford all of the visits.
Great, thanks guys. If anybody